Mothers can experience discomfort in the early part of pregnancy particularly. And these are not going to kill you, but they can be uncomfortable due to the physical changes in our body and also due to hormonal levels in our body at this time. There are various discomforts that mothers can experience, morning sickness being one of them. Mothers can feel quite sick up to the first 12 weeks, particularly of pregnancy. It generally subsides around 15 weeks, and definitely it's gone by about 20 for most mothers. To try and prevent this, it's important that you get out of bed very slowly in the morning, take your time, sit on the bed for a little while, and it would be actually very beneficial if you could get a little tea and maybe dry toast or a ginger biscuit before you get out of bed at all. It's also important that you eat small amounts frequently, and if you can try not to drink with your food, to drink separate to your food. It will subside, but it may take a couple of weeks. Heartburn is also something that mothers can experience in pregnancy. Not all mothers will experience heartburn, but it's generally later on that they will experience this. It's from the pressure of the growing womb. And women can, it's a burning sensation in their chest. Now, it's nothing at all to do with your heart. It's where you regurgitate acid from your tummy. Now, to try and prevent this, again, you've got to look at what's giving you heartburn. If it's fats, fries, curries, you need to eliminate those from your diet. Then you need to look at what might help you with it. Eating small amounts, again, frequently. Don't eat large meals at one time. Try not to drink water with your food. And sometimes milk can be very beneficial to counteract the acid because milk is an alkaline. Now, I'm not talking gallons of milk, I'm talking a mouthful of milk can help. And also propping yourself up in bed at night with 2 or 3 pillows can help you sleep better. It will go at the time of delivery, your heartburn's gone, you eat your first meal with no side effects, and it's a nice feeling. Constipation is prevalent in pregnancy, not again for all women. Some women will not experience any minor disorders, but some women do. It's important that you try to prevent constipation by upping your roughage, upping your fluids, and try to keep active if you can, swimming, walking, and these will all help to alleviate the symptoms of constipation. Sometimes women are more prone to mood swings in pregnancy, particularly in the early weeks. It sometimes takes you nearly 15 weeks to come to grips with being pregnant, regardless whether you wanted a baby or not. So you are a little bit more emotional, a little bit more tearful, but just understand this is quite normal. Your hormonal levels are changing dramatically. It's quite normal. You're not going crazy. And just be a little nicer to yourself and just try and be a little kinder to yourself if you can. Some mothers can experience a lot of tiredness in the early weeks of pregnancy. Again, their baby is developing, their baby is growing, and they are particularly tired up to 12 weeks. You've got to help yourself by taking rest any chance you get and not overdoing things. You must remember you're not superhuman and you do need to rest, and it will subside and you will feel an awful lot better by 20 weeks. And you generally feel very, very good from 20 weeks to about 37, 38 weeks, but you will experience tiredness again at the end of your pregnancy. And that is to be expected. Some women get varicose veins in pregnancy. Again, these are caused by increased pressure in the veins and also because of your hormonal changes in pregnancy. It's very important that you try and look after yourself, particularly when you're sitting down. Don't cross your legs when you're sitting down because you're putting more pressure on these veins. They're trying to push back this increased blood supply, and it doesn't help by crossing your legs. Also, when you come in from work in the evening, sit down, put your feet up and relax. And if you feel you need to wear surgical or support stockings, it's very important that you do so. You don't want to end up looking any worse at the end of this than when you started out. There are varicose veins, but they're in your back passage. They're bulging vessels in your back passage, again due to the pressure of the growing baby and also due to hormonal changes. It's important that you try again to treat them as you would with constipation. Up your roughage, up your fluids, try not to get too constipated, drink plenty of fluids. If they're extremely sore, you may get a cream to apply, and if you find that is not helping, you really need to consult your doctor.
The pelvic floor is a really important area during your pregnancy. With the extra weight, there is a lot of pressure pressing down on the pelvic floor, and you need to exercise the pelvic floor specifically to counteract the effects of the weight, but also to prepare you both for the actual delivery and then post-delivery. It's important to do pelvic floor exercises, and you can do those throughout the day, anywhere at all, whether you're sitting, standing, walking, but only do them as an exercise. You're not holding your pelvic floor all day. It's a very simple exercise where you draw up the back passage as though you're trying to stop yourself passing wind. You're trying to stop yourself from peeing, and you hold it to draw up, hold it for 6 seconds, hold, and then very slowly release. Make sure you're not drawing in your abdominal muscles when you do it. You're not tensing any other part of your body. It is just around the back passage and the pelvic floor.
Understanding your options is the best way to approach labour. Women who are well supported and relaxed often require less pain relief, so being prepared is very useful. It is important to recognise that each pain is short, it will go, there will be a gap between that and the start of the next pain. Relaxation is often the best way to deal with pain, and breathing exercises that are taught during the antenatal classes are an excellent way of providing good pain relief. Again, it doesn't take away the pain completely, but it does help you to deal with each pain as it comes, and it's important to remember that each labour pain only lasts between 30 and 60 seconds. So if you breathe through it and can relax through it and wait until the next one comes, then you're doing very well. So what are the options? Mobilising in the early stages of pregnancy is good. However, there will be a point where you will need to consider other methods of pain relief. TENS can be useful for some people. It uses stimulation of the body's own painkillers to ease pain. Its advantages are that it's drug-free, it's non-invasive, and it's self-administered. However, there is a cost of renting the TENS machine. It needs to be on from the start of labour, and it doesn't work brilliantly for everybody. Entonox, otherwise known as gas and air, involves breathing a gas and air mix that takes the edge off the pain. It's effective within 15 to 20 seconds. It's good for relieving some of the pain. However, it won't take away the pain completely. It's very safe. However, it can make you a little bit dizzy and drowsy if you overuse it. Some women will choose to have a pethidine injection. This is an intramuscular injection of a strong painkiller, which can sometimes make you feel a little bit sick. So it's usually given with an antiemetic or an anti-sickness injection at the same time. It can cause you to feel a little bit drowsy and make you sleepy, but this is no harm in the early stages of labour, as it does help you to relax a little bit. It is a method of pain relief that we try to avoid just prior to delivery because it can have a sleepy effect on the baby. So an epidural anaesthetic is probably the most effective form of pain relief in labour. It's very commonly used and it's very safe. A small amount of local anaesthetic is injected into the space just outside the spinal cord by the anaesthetist. This causes you to be absolutely numb from the site of the epidural down to your toes. It does mean that you won't be able to mobilise as well in labour, and it means that you won't be able to pass water. Some hospitals, however, also have a mobile epidural service, but this is not available everywhere, so you will need to check with your own hospital as to exactly what's available. The downside of an epidural is that it can be so effective that you may not be able to push in the latter stages of labour, and this does increase the chances of an instrumental delivery, either a forceps or a von 2s, and this is especially the case in women in their first pregnancy.
There are 3 signs that indicate the onset of labour: painful uterine contractions, a show, and waters breaking.
Painful uterine contraction. Contractions are cramp-like pain, similar to period pains that usually begin in the abdomen, stomach, and/or the back. When you are in labour, the contractions will be steady, reach a peak, and then ease. A sure sign that you are in labour is when the contractions come close together, about every 10 minutes, lasting more than 40 seconds each over a period of an hour or 2. Another sign of labour starting is a show. A show is a plug of mucus with a little darkish blood on it. It collects at the neck of the womb when a woman gets pregnant, and it can fall out as the womb begins to open. Another sign labour has begun is waters breaking. This is when the amniotic fluid that surrounds your baby starts to drain. The waters can release with a sudden gush or drain gradually. The water should be clear in colour.
Diagnosis of labour is not made on whether a mother has pains or not. The diagnosis of labour is made on the cervix dilating. The cervix is the end of the womb. It would look a little bit like that. And if the head is here, the cervix has got to open right back to 10 centimetres before she can push this baby through. There are 3 stages in labour. The first stage is all about the cervix dilating. The cervix must go from 0 to 10 centimetres to allow the baby to come out of the womb. And this is actually the part of labour that takes up the time.
Stage 1 of labour is when the cervix thins out and dilates from 1 centimetre to 10 centimetres. Stage 1 of labour can be further subdivided into early labour, active labour and transition. Early labour is when the cervix dilates from 1 to 3 centimetres. Generally, contractions are coming at regular intervals and can last for up to 40 seconds. Active labour is when the cervix dilates from 3 to 7 centimetres, contractions coming closer together and lasting longer. Transition phase is when the cervix is almost dilated completely. Contractions are coming rapidly with very little rest time in between. There are a few things that are worth being aware of. Breaking of your waters. During the first stage of labour, if your waters haven't already broken, your midwife may break your waters if you are more than 1 centimetre dilated. This is to look at the colour and volume of your water to make sure it's clear, but it also helps your labour progress. An oxytocin drip. If your labour is not progressing well, it is not unusual to be put on an oxytocin drip. This will strengthen your contractions, making them more effective. Fetal monitoring. Your baby's heart rate is monitored throughout labour. It should be 120 to 160 beats per minute. Generally, it is listened to every 15 minutes, unless there are indications that require continuous fetal monitoring.
The second stage of labour is very different to the first stage. The first stage is all about waiting, coping with pain and hoping you get there soon. The second stage is about pushing, it's about hard work, it's about getting this baby out. But the good news is that it doesn't last for longer than an hour for a first-time mother, and some first-time mothers can deliver a baby in 40 minutes or 20 minutes. 10 minutes after the delivery of the baby is the third stage of labour, and at this stage you're going to feel an uncomfortable feeling in your tummy. This is when the afterbirth is separating from the wall of the womb, and you're going to feel an uncomfortable feeling. It's not like a contraction, but it's uncomfortable. And as you feel this, we're going to ask you to give one last push. And as you push, we direct the afterbirth out. Babies are also delivered by suction, which is another name for vacuum or ventouse extraction, or by forceps delivery. And the indications for either of these is that the baby gets stressed, or maybe the head is sitting there, the mother just can't get this baby out herself. And these procedures are always done by doctors. Midwives conduct normal vaginal deliveries, doctors do cesarean sections, forceps, suction, anything out of the norm. Okay. And for these procedures, if it was a forceps delivery, the doctor would put a forceps on either side of the baby's head like that and just help the baby out. You'd give one good push and the doctor would help the baby out. Okay. So it's an assisted delivery.
With a forceps assisted delivery, a metal instrument shaped like large metal spoons with hollow heads are placed on either side of the baby's head. And then in time with your next contraction when you are pushing, the doctor helps the baby out.
Suction or vacuum or ventouse is also known as vacuum or ventouse extraction. They'll put a little rubber cap on the back or steel cap on the back of the baby's head like that, and they'll ask you to give one good push, and as you push, they'll help the baby out with suction.
For a vacuum assisted delivery, a plastic or metal cup is attached to the baby's head and a vacuum is created by suction. The doctor helps the baby in time with your contractions and pushing until the baby's head is delivered.
Now, these are very useful procedures used in the right place. If your baby was stressed and you couldn't get it out, you'd be thrilled if somebody said, I'm going to help you here. So they're very useful in the right situation.
For an assisted vaginal delivery, it is generally necessary to perform an episiotomy. An episiotomy is the medical term for a small incision that enlarges the vaginal area to accommodate the delivery of the head.
Some women need caesarean sections. The two big indications for caesarean section are babies getting stressed and mothers not making progress in labour. Now there are other indications, but they're the two main ones. You always need to have caesarean section written at the back of your head because you don't know when you can end up having a caesarean section. It's done in the operating theatre. It's generally done under regional block, which is either epidural or spinal anaesthesia. It's done by a doctor with assistance, and it takes a very short time to get a baby out. The scar for a caesarean section is very low down. It's called a bikini line scar, so it's a very low down scar, so it heals up very well. The baby is taken out, the afterbirth is taken out, and then the doctor starts stitching. And there are 5 different layers to be stitched, and that takes about half an hour.